Good evening. Welcome to Rounds with Evening Rounds with Dr. Vigna. I'm a board-certified specialist in physical medicine, rehabilitation medicine, with over 15 years of clinical experience. I'm a certified life care planner. I'm licensed to practice law in California and have a personal injury practice. Tonight I'm going to talk about the acute spinal cord injury process, what is happening in the emergency room to your loved one. And I'm sorry that you might be watching this in a very difficult time. When a patient presents to an emergency room with following a spinal cord injury, they're most likely critically ill. They have associated injuries, brain injuries, pelvic fractures, uncontrolled bleeding, pulmonary contusions, a whole plethora of miserable problems. The physicians in the emergency room will be doing their best to stabilize your loved one. They will also be very mindful of certain protocols which have been shown to improve neurologic outcome. Of course, your loved one's going to be immobilized to prevent secondary injury to the spine, but there will be a focus on, can this patient receive IV steroids or can't this patient receive IV steroids? Steroids given within the first 8 hours have been shown to improve outcomes of both incomplete as well as complete spinal cord patients. There is also going to be an early focus on, can this patient medically get through a decompressive surgery within the first 24 hours, because outcomes again have been shown to be improved with the early surgery. Unfortunately, children less than 13 can't get steroids. Pregnant women can't get steroids. Intra-abdominal injuries, significant intra-abdominal injuries with bowel perforations can't receive steroids. So there are reasons why people can't have early surgery and steroids. There is a new modality which has been shown effective in laboratory animals and in clinical practice today in some of the major centers, and that is therapeutic cooling. Cooling is felt to work along the same route as the steroids. Steroids decreases inflammation, which will decrease pressure on the spine, but also there are some secondary mediators in the inflammatory reaction that have been shown to damage the spinal cord. Cooling will decrease inflammation, the pressure, as well as decrease these secondary effects which can damage the spinal cord. It's my feeling that this is a useful intervention, but if it means a difficult transfer to a faraway facility, I probably would say that this patient should stay where they are, get the steroids, get the decompressive surgery, and look for the very best rehabilitation facility in the area. I'm a physiatrist. I've trained at Texas Institute of Rehabilitation Research. That's part of Baylor College of Medicine in Houston, and it's considered one of the top 5 spinal cord centers in the country. If you or your loved one has had a significant spinal cord injury, you must go to one of the best centers. The best rehab you could get will set the stage for you functionally, physically, mentally, and vocationally. The scope of services at these model spinal cord centers are tremendous. You're talking, you're going to be dealing with the best trained physiatrists. That's what I do, a physical medicine rehabilitation specialist. There will be plastic surgeons available, the best orthopedic surgeons available, best neurosurgeons available, best neurourologists available to handle neurogenic bladder issues, psychologic services, family education. You will be truly educated at these model centers in terms of what a spinal cord injury does to the entire body. It's just not the spine, it affects every organ system, and education is very important. Again, it's never too early to think about rehabilitation. It's a long road. It can be a very difficult road, and those thoughts should begin acutely during the acute stay at a hospital. I'm sorry if your loved one is injured or you're injured, and I hope this helped you in some way.